to Your Comment Matters. I'm your host, Carol Love, and today's video is going to be coming from WLOS News 13. And the title of this video is Medicaid Cuts to Affect Millions in the North Carolina Health Secretary says. Now, this video got 466 views, but we only found one comment. Well, you know me, right here at Your Comments Matter, even if it's just one or you don't make no comment, it still matters, doesn't it? So today's commenter is going to be Palace Athena. So if you're watching today, welcome to Your Comments Matters. Well, everyone, let's get into the video and let's see what's still cooking out here in this Medicaid crisis that we're facing here in America. Let's watch the video, shall we?
North Carolina's Health and Human Services Secretary writes an open letter warning of potential cuts for millions of North Carolinians and cuts to providers with looming Medicaid cuts.
News 13's Kimberly King is live in Hendersonville, where she talked with the director of the free clinic that is located there. Kim, what can you tell us?
Tammy, the state's health secretary cited potential cuts that could go into effect by October 1st, could include programs like hospice. But the political debate is at the center of this issue, and it is, how much should the government provide? Pauline Carpenter is executive director of free clinics in Hendersonville.
Even some of our folks that are insured, they can't afford some of their medications like Ozempic, different things like that, that we provide here for free.
Ozempic, the weight loss drug on the list the state's Medicaid program could end. The deeper question around federal health care is how much should the government provide for low-income residents?
No one should have to walk around and have a chronic disease that's untreated.
That's right.
Isn't that socialized medicine?
Basically, but it's access to care too. Like,
exactly.
Is that what's at risk in your opinion?
Yes.
This month, the state's health secretary writing North Carolina's elected state reps and senators a 4-page letter warning of federal cuts, forcing NCDHHS to cut $319 million from Medicaid by implementing rate reductions of 3% across all providers and elimination of certain services. It is impossible to fill the funding gap without making reductions to acute care hospitals, nursing homes. NCDHHS will end optional coverage of GLP-1 drugs for obesity, which affects more than 1 in 3 North Carolinians, potentially reducing costly chronic-related conditions like diabetes and heart disease. On top of medical cuts, the director of the area's medical society says we worry about families having to choose between housing, food, and care, and hope the cuts don't cause hospitals to close. A UNC study states Angel Hospital in Franklin and Blue Ridge Hospital in Spruce Pine may both be at risk. The state's healthcare association says Trump's Big Beautiful Bill could cut up to $50 billion in Medicaid funding to the state over the next decade.
Oh, they clapping, y'all. Oh, they clapping.
We had an uptick after the hurricane. Since January, we have seen
all that money.
200 new neighbors come through our door.
Doors open to anyone in need. The concern now, how exponentially will the need for free care grow? The free clinic site opened more than 20 years ago. It depends on grants and donations from the community. Now, Republicans have spoken out saying that the threats from the secretary are pushing back. They say they're calling for more fiscal prudency when it comes to the health care budget.
All right, another great video, everyone, when we're still continuing the talk of the Medicaid healthcare crisis that we are facing. So you saw it right there. You heard the lady talk to this clinic and stuff. So let's just gather a few bullets from that video, all right? So she spoke about that there's going to be cuts to the providers, like that free clinic that we saw, the lady that spoke about that, and like people that's getting hospice care, there are going to be cuts to that. And then they were saying that that no one should walk around without care. Everyone should have the opportunity to receive care. And we're talking about the legals, right? Not the illegals. You know, get here legally and you can receive the care and all the other amenities that this country has to offer, but not for the illegals. It's for the legals. Let's get that, everyone. Let's get that straight. Okay. All right. And so they also said that there's going to be $319 million to be cut in North Carolina. 50 billion is going to be cut in the next 10 years. Yeah, that's a lot of money. So people are going to have to choose between food, housing, and their health care. So there it is right there, isn't it? There are some big choices going on in this Medicaid crisis today. Well, everyone, we saw the video and now we want to hear the commenters. What do they have to say? What do you have to say? Are you going to agree with them or not agree? Then if so, let us know right here in our comments on our channel here today. All right. So let's get into the comments and see what they have to say. Okay. Well, we only had one because that comment mattered. This commenter mattered. This comment is coming from Palace Athena and says, it's not about how much should be covered as how much should it be allowed to cost. Ooh, good comment. She only got 2 likes on that one, okay? But that's a good point. So it's not about how much should be covered or, but how much is all of this stuff costing? Because we want to get the cost of our healthcare down too. If you get the cost down, then people can afford it without having to have all of these subsidies coming. But if you make it so extremely high, the poor man can't afford it. The middle class man can't afford it. So they need extra help. They need it. That's why we got to see where the waste is, see where the fraud is. And if there are illegals in the system getting it, they got to go. They got to get off the system. That money needs to come to the legals, to us Americans. Okay, that's where it needs to go. We work for that money. It's our taxpayer dollar. When I'm retired now, but I worked for over 30-some years. And let me tell you, I got up every morning at 5 o'clock. I had to get my kids ready, had to, get in the car, had to commute, go to work and come home, leave in the dark, come home in the dark, work. And then when I get to retirement age, you're going to tell me I don't have no Medicare coverage. It's going to be this much. What? My premium's gonna be this amount. No, no. Go in, get out the waste, get out the fraud. Okay. So you can have a healthcare system for the legals. Okay. If you're here in America and you're illegal, then you better get around and making yourself legal so you can have the benefits that we legals enjoy as well, if we ever get them. Okay. All right, everyone, that's going to do it for the show today. We want to give a shout out to Palace Athena. We only had the one comment today, but even though your comment matters, so we appreciate your comment. All right. Okay, then, everyone, that's going to do it. And we are going to see you on the next video. Thank you for watching, liking, sharing, commenting, and subscribing to Your Comments Matters, because they do. Your comments matters. That's why you make them. And then somebody else read it and say, hey, I like what he or she said. Hey, let me give you a like on that. See, a lot of us can't express ourselves in a written form, but when we read what someone else said, they wrote exactly what we could have been thinking. All right, then, everyone, that's going to do it for us. See you on the next video. Take care.